Our study was so actually our paper is more focusing on the racial disparities in the area, and that's a great question. So the health equity, the lens, right? So we do see that actually racial ethnic minority backgrounds, for example, Black or African American, Asian or Pacific Islander, and American Indian, Alaska Native, they are more likely to decline chemotherapy, radiation therapy, and surgery. But interestingly, though, so they are less likely to decline hormonal therapy, which is kind of interesting. But we're trying to really, to tease out, why we're seeing that. But in terms of Hispanic, or Latino, patients, it's really across consistent. They're less likely to decline. So that's why we're thinking about, if it's from, health equity lens, then in this case, then, how can we, better address, that disparities through, maybe equity-focused interventions, right? So, but we talked about a lot of the patient-provider communications, but is anything that we could, improve that? But also at the same time, how can we have, a better shared decision-making on recommended therapies? But also at the same time, that maybe some cultural beliefs and maybe even religious belief may play a role in why they decided to decline those treatment recommendations, but unfortunately it's not assessed in our studies because it's not collected by the database. But I think will be important to look into the future. So, but in terms of intervention, I think really just sum up. So I think really to address or to reduce us the racial ethnic disparities in this case, and we do need a lot more comprehensive, equity-focused intervention to do so.